Examine your fistula every day, and it'll only take you a few seconds. You should have a steady thrill, and what that means is there's a buzzing sensation like a cat purring or like a motor humming. Think about if you rest your hand on top of a clothes dryer when it's operating. That's what the thrill should feel like. If you raise your arm above your head, assuming your fistula is in your arm, there are some that are in your leg, the fistula should soften and collapse. When you drop your hand down below your waist again, you'll see the fistula fill. That's important because it shows that there isn't any blockage to the fistula draining well, that when you raise your arm and gravity goes to work, blood flows very easily and completely out of your fistula and into the veins in your chest. That need not happen for everybody, depending upon the blood flow rate, the size of the vessel, etc. But it definitely should soften, and you should notice that the fistula is not as firm as it was when your hand was down by your leg. I encourage people to get a stethoscope and to listen to their fistula every day, and it should have a soft whooshing sound. And if you've ever had an ultrasound where they use the vascular probe, you'll hear the system going whoosh, whoosh. That's what your fistula should sound like when you listen to it. There should be a constant sound, and it should be that low-pitched whooshing sound. You hear a high-pitched whistle, or if you hear the sound intermittent where you hear sort of a squirt and then it's quiet and a squirt and quiet, that's a fistula that has a blockage in it. And if you hear that, definitely speak to your nephrologist about a referral to the surgeon for that. The skin over the fistula needs to be intact. And if you notice that the skin is very shiny or the skin has become particularly thin or appears to be infected, that is a surgical emergency and needs urgent attention. The upper image here shows a very large fistula. Some people will call this a megafistula. That is one that is probably the result of high pressure or high flow over time. It's completely safe to use that, and there's not a problem with it unless the flow is so high that it compromises heart function. And again, that's where your cardiologist and your surgeon will come together and decide the best approach. The image on the bottom is one that is very, very concerning. You'll notice a few things. For one, skin is shiny, and that usually means that the skin is tense and stretched. Number two, the skin is red, and that signifies that there very likely is infection there. And if you look slightly to the left of this bump, I'll call it, you can see there's a whitish area, and it looks as though there's a little dimple. That is probably a needle site fully, and those have a very high likelihood of rupture, meaning that the fistula can burst with uncontrolled bleeding. So the dialysis team is very well trained. They will recognize this as an emergency if they see it. Home dialysis patient, and you see this, you need to contact your physician immediately. What about a clotted fistula? We don't see them as much, thankfully. Grafts tend to clot more often than fistulas, but fistulas do clot, and it's very, very important to have the clot removed promptly. Sorry, I left the T out of promptly. It does become more difficult to perform that procedure as time passes. So if you are listening to your fistula every day and you notice that the bruit, the sound of your fistula has stopped and the thrill, the buzzing feeling has stopped, notify your doctor immediately.